I was invited to lecture in 1986, and I did it on cancer. And I showed the cases, showed the records. One of my best friends left the room and stood outside the door of the lecture room and said, "Don't go in there. This guy is crazy." At that time, the wall against alternatives was so great, I never had a chance. But I kept on making patients better. Every major chronic disease is on the rise.
I'll see you later.
And now, I'm not satisfied in being able to take what I've learned and what I've applied and keep it confined. Yes, I've been criticized, but after 45 years, I'm very proud knowing that what we're doing works. Hey, how's everybody doing?
Good morning. Tilly's here for Dr. Goldstein.
Hi. Hello. Let's go, we're ready.
Hi, how are you?
Good morning.
Yeah, that's right.
You ready?
Said that he did a brief ultrasound and found masses throughout her spleen.
They've already tried 20 different drugs. None of it's worked. So let's start using IV vitamin C therapy.
With cryosurgery, we actually freeze the tumor, buys us time to work on the immune system.
So we have the MagnaWave here. Dr. Jen is going to give her a MagnaWave treatment.
Good.
Her other vet was about to put her down today. We can help, and we're going to keep moving forward.
You're going home.
That's the whole mentality difference about how we look at things differently.
It's gone so far. How?
We don't want to remove his leg if it's something that we can save.
Okay, are you going to come down for the consult, or do you want to do a phone consult?
Coming in to see Jenna tomorrow at 12 noon.
One appointment available for Dr. Shane for today. Dr. Goldstein is probably going to be in surgery. Requested a copy of a CT scan for a mutual client a couple times, and they're here for their appointment right now, and we still have not received
Katie is ready to go back.
The other doctors, we have to do 5 months to live. It was 4.5 years ago. Can you give him a lollipop?
I'll just wait till she's awake. Oh, and then we can.
This really looks great.
Cav, can you give me an 18-gauge needle?
Come on, Zeus. You're a neat guy with a big head.
The other vet scared me because he was like, well, it could be cancer. We might need to amputate the toe. Do you think that we need to do that on this? Oh my God. That's why I started getting really nervous that they...
I've set my life up, not only to be a veterinarian, but a veterinarian that deals with hopeless, terminal cases from all over the world. Most of the animals that we see already had second, third, fourth, and fifth opinions before they came here. And now we are their very last hope.
Each one of these spots is a lung tumor. Must be 100.
I teach my doctors that you want to get to a point where you're trying to support that patient's immune system. so it could heal itself.
This is going very well, very well.
And what I've learned over the last 45 years is that we have to treat a disease by using conventional and alternative medicines together.
Waffle is here for Dr. Ruskin.
Let's see. So it looks to me like you adopted, and at that point, we were 100% healthy. You didn't notice anything?
He was fine at that point. We would play outside. He jumped up like a little
Little
jumping bean.
Okay.
And as time progressed, he started not playing. I tried different toys. He wasn't interested, didn't chew on sticks. So it was like one thing dropping off.
Kept seeing quality of life go down, down,
Go
down.
down and
Yeah.
down and down. I had been going to another doctor to get him in for his updated shots, and she said he has a fever, so she put him on metronidazole. And then I took him to my vet. He had them run blood work and some more x-rays and said, this really is out of my league. I think you should go see an internist at an emergency hospital.
Okay.
Whereupon she put him on doxycycline for 2 weeks, and they said you should see him pick up after 5 days. Well, it's 14, and this is
still it.
still where we are. And I've been loading this dog up with food. I don't know where it's going.
Okay. You must be just overwhelmed. I can't
am.
imagine, because
am.
I look at this. I mean, we see the worst of the worst here. We get files this thick here, and even I'm overwhelmed by all the twisting and turning, of this case. There seems to be things going on everywhere. There's possible joint inflammation, there's possible liver inflammation. And he was described as having a hunched position. Like, was he walking, like, kind of with his
He
back
had a hunched
arched?
back arched.
Okay. Can we put him on the floor so I can see how he walks?
Come on.
And so he's kind of doing that arched walk still with his back. Hi, sweetie. Hi. See this, how he, when I back him up, see what's happening with this right hind leg?
Yeah, he's not really doing anything.
The rabies vaccine is given in the right hind leg. So the patients that I've seen that have a rabies vaccine reaction, the right hind leg declines first.
Right.
And then it gets, then it progresses up, from there.
Okay.
So the vaccines, I believe they have a place as far as preventing disease, but they shouldn't be given to a patient who's not healthy. Otherwise, they have more than the immune system can handle, and it just makes everything snowball. And vaccine reactions do get worse with time. And, unfortunately, conventional medicine doesn't really have, a treatment for this, but we do, so.
You do?
We do, yeah. Hallelujah, yes. Yeah, so, the case, I can't promise you that he's going to have the same response as other cases. It's okay.
So you're not sure that he can be saved?
I'm not sure that he'll have the same response as other cases I've had, but here what we use for this is something called intravenous vitamin C therapy. What it does is it helps clear the body, and it helps improve the immune function, and brings that inflammation down so that his body can start to function properly again. Then, hopefully we'll see his appetite improve and be able to thrive from there. But we need to catch it now, because of what I'm seeing. It crawled up his spine. He got the arched spine, and and it's heading up to here. We don't want it to get to here, because when it starts to get to here, we start to see seizures. We start to see more serious things.
Okay.
But we'll have to take it day by day and see how he does.
What I hate to ask what the cost is. I've spent
Yes,
so
I
much
know, I
money on
see
this
that.
dog.
Yeah, I see that. Typically for a dog his size, it's $1,200 for the 3 days that they're on therapy.
That's fine. That's fine.
yeah.
I don't care. I'm
So-
working right now to pay for this dog. Only thing I need to do is call my husband.
Of course.
Okay, so she'd like to take him, and they give him, it's called a vitamin C therapy intravenously. And I would like to do it. It's going to cost $1,200, but I would like to do it. Are you still there?
Hi. If you feel good about this.
I do, and if it doesn't work, it doesn't work, but I really want to, I want to feel when I go home that I've given it my best shot.
So yeah, we're going to do a chest x-ray, blood work, GHP, CBC, and a T4 actually as well. And then staying overnight, so we can go over. Ready? Vitamin C works fantastic for something like a vaccine reaction. Some people aren't ready for something that bizarre as a treatment option. You know, it's difficult even for me. I've been doing this for 10 years now, and even for me, it's difficult to wrap my mind around it. And then all I have to do is treat a patient, and then I'm okay. You know, there's no way you can have placebo effect, you know, on a dog or a cat. But it's going to be IVC tonight, tomorrow, Friday, right? Unless we see a miracle in 24 hours. And sometimes it doesn't work, but usually we get at least better energy in eating, even if we don't solve the disease. And you know, always that's the most important thing, is just improve quality of life. But a lot of times we get more than just better quality of life. We really reverse things. Dr. Marty actually is the one that pioneered this in dogs and cats. He actually took the protocol that was being used in humans and adapted it to pets. Back in the day when he started using it, there wasn't such a thing as injectable, sterile vitamin C therapy. So what they used to do, I mean, this is crazy, but what they used to do is actually open the IV bag, pour vitamin C powder into the bag, and kind of shake it up to dissolve the powder, and he saw incredible response.
How is he?
It's hard to say.
1973. Right after I graduated Cornell Vet School, I was working in conventional veterinary medicine. I became a workaholic, and I was living on junk food. I always had heartburn, I always had headaches. I became a very sickly person. I was diagnosed with chronic bursitis, arthritis. It seemed that if someone had a cold, I caught it. I go to my doctor, I said, "What's going on?" And he said, "Well, you are getting older." I was only 26 years old. And then he recommended antibiotics and long-acting steroids. And when I said to him, "Is there any other alternative?" No answer. And that got me searching for answers that conventional medicine didn't offer. At that time, there was no such thing as holistic medicine. I had to travel like 35 miles just to find a health food store.
A little pumpkin seed oil. Yum.
And I did a lot of research on the biological effects of good food, acupuncture, homeopathy. Finally, I said, you know, I gotta try this. Over time, everything went away, and that was the wake-up call. What I learned is that my immune system was dysfunctional. It's either suppressed or not working correctly. In medical school, we learned how to diagnose and treat disease, but we should also be treating the immune system. And it hit me. If this works for us, why don't it work for an animal?
Come on, buddy. Well, welcome to Smith Ridge. All right, I'm just going to get a little bit of information. I know we have your medical records.
All right, the doctor will be right in.
When he vomits, is it once a day?
Sometimes 12 times at a time.
Oh, really?
Yeah, it's a lot.
Let's start with injectable homeopathics.
Okay.
The last vet that I went to told me I should start thinking about putting him on the medication. Then if missing a dose, I hear it's fatal, I've been told.
You know, I find oftentimes, we don't have to go down the medication route.
Great.
What we want to do is feed them the closest to what they would eat naturally. So for us, that's raw diets. 80% meat and 20% ground up fiber.
If I said this to the vet that we used in the past, what would they say about what you're telling me?
It depends, because in vet school, they don't educate us on nutrition. He's a puppy, and we have to be careful with how much protein.
In the US, there's only about 5% of practices that offer integrative care. Either the people who are studying sort of the holistic or alternative say, no, I don't want to do anything conventional. Or you have the conventional vet who says, no, absolutely no alternatives.
It's okay to leave water down.
So we get consults from all over the country. Well, my local vet is unwilling to do this, so I'm calling you.
So I'm first going to put in points that kind of help calm her, because she's a little bit of a cranky girl. And I happen to love cranky cats. Most people come in and tell me their friends are saying, oh, you're crazy, you shouldn't be doing acupuncture on your pet, it's a bunch of crap. Until you sort of see it for yourself, you don't believe that it's possible. And she's had a great response to it.
I know you were given a very bleak prognosis.
Yeah.
Let's take a listen to you.
Well, a consult is an hour. We're reviewing hundreds of pages of medical records sometimes for that particular appointment. I'm going to send you home with supplements that have some anti-inflammatory benefit. It could take a little bit of time, but we're definitely going to be able to help her.
Well, she means the world to us.
It is very, very rare that we cannot offer some hope. And that doesn't necessarily translate into a cure, but it translates into something that is fair to the animal and not do anything that is going to make them miserable while we're trying to extend their life.
Oh, thank you. Thanks. Okay.
I'm hoping he'll like my home-cooked stew. We'll see. Hey, honey, I bothered you again? You want to try something? Precious. What do you think? You try that? Good boy. Good boy, honey. All right, guess I gotta get him more meat. Oh, much better. Good boy. I like that I can't keep him still today. Where are you going? Come here. So I'm seeing an improvement in his the way he's using his right hind leg. So it's much stronger. Number one, he's putting more weight onto that side. And you'll notice he moves it faster than he was the first day. Much faster. And he's also standing taller. So we've come actually a long way in the past couple days. His color's really good today. He's bright-eyed, eating, walking around, and he's wagging his tail. That's, the beginnings of quality of life coming back.
Hey! Hey, look at you! I haven't seen you wag your tail in so long. Look at that nice little wag I got out of you. Oh, what's my boy doing? You're acting like a dog. Here he comes right now.
What's he doing? Walking around?
He pulled me on the leash all the way down there. He pulled me all the way up there. And then the nurse had to come out and say, look, you're letting him do too much. We're going to get you better. Don't you worry. I'll do all the worrying for you.
And there goes my life.
Please give me a call back. To be honest, I don't think it'll stop before 533.
Mulligan is here for Dr. Goldstein.
We got him as a puppy, and I didn't know anything was wrong until he just kept drinking water as a baby and just peed constantly. We went to a veterinarian clinic. It turned out he had compromised kidneys, and he was born with only 15 to 25% of healthy kidney tissue.
Did they have the word renal dysplasia?
Yes, that's it.
Renal dysplasia.
Yeah. Damn. And when we asked how long Mulligan might last, they said could be a week, could be a couple of months. Really, it was a death sentence.
So basically, he has a genetic or congenital predisposition for his kidneys to fail. The kidney is responsible for getting rid of poisons from the body. So this is like a veritable time bomb, because if he's functioning on 20% of the kidney and he suddenly goes down to 18%, he could start going into renal failure.
Oh yeah, it's all bad.
Now, genetic predispositions cannot be changed. However, their ability to manifest as a disease can be altered. So if we work on his health and not the disease, we could help the body keep it in check.
Right, okay.
It's not more complicated than that. What are you feeding him right now?
I'm told that he really has to eat wet food, and he hates wet food, despises it. So I make stews and things.
I like the fact that you're cooking. We're going to supplement the cooking with supplements and remedies.
Okay.
I'm going to give 2 injections today, and then we'll just do a routine blood test in a week or 2.
Okay.
If the kidney values are dropping, or at least staying the same,
no, that'd be great.
That's it.
All right, I'm committed.
Mulligan, we got work to do. We always take blood on every patient, even if they're healthy, and put them on supplements based on deficiencies. And that's because nutrition is often the underlying problem in almost every case we see. Take a look at the main ingredients of the most popular pet foods. And what's the first thing you see? Corn. Not the best ingredient for a carnivore. And if you see the first ingredient is meat, you think it's the most prominent ingredient. But if you add up millet, brown rice, oatmeal, you'll see that 70–75% of the food is actually less expensive grain.
I'm glad they made your Gaines burgers with more real meat.
Plus, in the 70s, we had the entire age of the semi-moist foods.
You'll be glad we made them taste better.
You take it out of the cellophane wrapper, you throw it in the bowl, you go over 5 days later and it's still moist. It was like, what? They had 4 or 5 chemicals, dyes, flavor enhancers. And guess what wasn't in there? It was devoid of food. And this is one of the reasons a dog as young as Mulligan is born with malfunctioning kidneys. So a supplement in the highest form should be a concentrated food to make up for the deficiencies in the food chain that we passed on to our pets. However, even though there's scientific backing, supplements are not part of the everyday veterinary protocol. But that's something we've been trying to change for decades.
Whiskey, a 120-pound Rottweiler, is the picture of health today, but 6 years ago, he was stricken with a bowel disease that's usually fatal for his breed.
As far as I was concerned, the dog was dead.
These are pictures of him then. After 2 months at an animal hospital, he had wasted away to less than 60 pounds. Vets gave Whiskey just days to live, but his owner went knocking at the office of Dr. Marty Goldstein.
Marty took one look at him and said, I think I can save him. And I didn't believe it for one moment.
We figure every animal has a chance or deserves a chance.
Where traditional veterinary medicine had failed, holistic medicine succeeded. Using homeopathic remedies and acupuncture, Dr. Goldstein had Whiskey on the road to recovery within a week.
To this day, I think it's a miracle.
No miracle, says Dr. Goldstein, just nature at work. Trained in traditional medicine with a degree from Cornell University's vet school, he's become convinced alternative medicine is the way to go.
And while many traditional vets recognize the benefits of what Dr. Goldstein practices, some do question what he preaches.
Hey, babe.
What?
Come here. There's a guy that's writing a blog about you.
Oh.
Whoa, Joey, wait. He says, being learned and experienced in the use of unproven and quack therapies makes one an expert only in a narrow and fundamentally misleading sense. An expert on homeopathy is like an expert on astrology or a long-dead religion.
He's already made the decision that it's bad.
I know.
Respond to him.
I know. Well, it's a blog. I can't. I don't know.
Oh,
I'm
it's a
not gonna-
blog. Is he a vet?
I think so.
If we should contact him and invite him to Smithridge.
This is the other thing that he says. He says, I've talked frequently about the problem with concept of alternative medicine experts. They know a great deal about something fictional, but this knowledge is only useful.
Over the years, I've been called so many things. Snake oil salesman, charlatan. He's not practicing accepted veterinary medicine. He used to be a good veterinarian. About 20 years ago, I lectured at Cornell, my alma mater, and I showed him all these before and after pictures. It went in one ear and out the other. But now I have enough before and after cases where you don't have to be a rocket scientist to realize, hey, we did something beneficial to the life of that dog.
Okay. This is Shadow. She has had significant arthritis for a couple years, and she's getting magna-wave therapy.
All right. It's gonna feel a little strange, kiddo.
So it's basically a very strong way of using magnets. And what it does is it pulses the electromagnetic field through the tissue, and as it pulses, it increases the blood flow to the area. And if we're doing that, we're decreasing the inflammation to help relieve some of the pain. Good girl. I can understand Marty's frustration over the years. My father's a chiropractor. And I remember growing up in that environment where people are like, what do you mean chiropractic? Or what do you mean, supplements? Or what do you mean good diet? And they would look at you and be like, oh, that's not medicine. So I watched my father going through all of the same things that I hear Marty talking about.
Marty, okay if I turn out the lights for a second?
Yeah.
All right, let's take a look here, kid.
Good girl, it's okay.
Growing up, I never imagined that being a vet would be all this medication. I imagined it would be doing the same thing for pets. So that was the hardest challenge for me, was getting out of school and being like, I have to go work in conventional medicine where there was an expectation that I would treat conventionally across the board. And if I didn't treat with all the medications that they thought was appropriate, I got in trouble. It was hard because you were always covering up a disease with a medicine. You were never getting to the basis of what was wrong. And then a very dear friend of mine is like,
there's a position over at Smith Ridge. Why don't you go over there? I was like, what's Smith Ridge? Looked it up and found out that this was a practice that was doing exactly what I dreamed of doing.
Oh, I know that's the sore part right there, huh? Right in your shoulder. Good girl.
But it comes down again to a single practice versus, you know, having it as more of a standard of medicine.
Good girl.
Well, I tell you, for me, when somebody first brought up a holistic vet to me, I was like, what, so they can take grass and rub it all over my dog and get my dog better?
There's 190 million registered dogs and cats owned by 67% of the families in the United States. And the scary thing is, 1 out of 2 of them could die of cancer.
We've got increased rates of cancer, diabetes, you know, you name it, whether it's a person or a pet. It's all degenerative diseases now.
Yeah,
20
so
years ago.
1997. I had a patient, and she moved from my practice in Los Angeles to New York. And a mutual friend called me one day and said, you know, did you hear she got tied up with this crazy veterinarian who's charging her like a ton of money for vitamins and herbs, and her dog has cancer. And he's telling you can treat cancer with diet and herbs, and I was incensed. I was so angry. So I thought, well, I'll get this guy's license revoked. I'll get him out of our precious profession, right? So I called him. I called him on the phone, and I wanted to find out what his shtick was, right? So I said, I hear you cure cancer. And I expected him to say something that I could nail him on. And he said, oh no, we don't cure cancer. I said, but I thought you treated cancer. And he said, no. He said, what we do is we actually support the immune system. And when you make the immune system stronger, sometimes really amazing things happen. And I went, that's how he gets away with it. That's how he gets away with it. So I'm like, hey, would you mind if I came out sometime and just like saw how your practice works? And he immediately said, yes. So he flew to New York, go to his practice. I thought there was going to be a bunch of hippies, you know, all walking around smoking dope and hugging, and the hugging part's true. So he presents case after case after case of all these cancer patients that are getting better. And remember that paralyzed dog from northern Colorado? Yeah, so this dog came from the biggest neurologist in the United States, failed on this case, said it was a hopeless case. Marty sticks like 12 needles in this dog, and the dog gets up after being paralyzed for like 3 months, gets up and walks over and puts his head in the lap of the owner. And so the only thing I could do is, I'm here to destroy this guy. He just did the biggest miracle of my entire career. I actually fainted.
You passed out.
And so when I woke up, I have a completely different view. So I changed my practice. I changed the way I did medicine. I started helping more animals and using fewer drugs. And the science is coming out now. I mean, we have a study that's showing markedly improved survival time for cancer patients who receive the best of Western cancer therapy and the best of integrative medicine.
This is not snake oil, but there still is a wall of resistance.
The whole point of integrative medicine is it's part of medicine.
Dr. Goldstein, your appointment is in room 2.
So the breeder gave him one vaccine at 8 weeks.
Right.
You did one at 13 and a half weeks. And now I'm under the impression that we should do the parvo this 3rd time.
Oh, yeah. But after that, we have a thing called a titer.
Okay.
A titer is a blood test that measures the level of immunity generated by the previous vaccine. Oh. And if it's positive, he's most likely protective against parvo.
Okay.
And we can titer for most vaccines throughout his life. And if he's immune, you don't have to worry about it.
Okay, I like that.
Okay. But rabies is a different story because rabies vaccines are mandated by state and federal law.
Okay.
Now, if there wasn't a tie between the immunosuppressive effects of the vaccines and all the cancer and other disease we're seeing, I wouldn't be talking about this. One of the most controversial issues I've been fighting for is the proper administration of vaccinations. That's the American Veterinary Medical Association, the governing body over the entire profession. Vaccines and sarcomas, a concern for cat owners. The tumor grows at the site of the vaccine, because most cats get the vaccine between the shoulder blades. So now the recommendation is vaccinating the cat in the rear legs, or now they're even trying the tail, so that when the tumor grows, you could remedy the situation by amputation. And it's not only the vaccine, it's not only the organism, but the thing that makes the vaccine more powerful, called the adjuvant. An adjuvant is typically a chemical put into a vaccine. It causes an inflammatory reaction at the site of the injection, so the vaccine gets absorbed quicker into the body, so it builds up a higher level of immunity. Another concern is over-vaccination. Because the typical puppy would get a series of 3 when they're young. 8 weeks, 12 weeks, 16 weeks. After that, many veterinarians vaccinate every year. The dose is 1 vial per pet, regardless of weight, age, or breed. But also, the vaccine could be up to 10 times the potency needed to challenge the immune system of a Great Dane. And the same dose is given to the 2-pound Chihuahua. And it's been scientifically proven that 1 vaccination can generate immunity that lasts many years. So if your pet is due, have your veterinarian take a titer. And if a dog has a positive titer against, let's say, distemper or parvo, then they're not due just because the calendar says. So what I'm not saying that I'm anti-vaccine. I am pro-sanity.
All right, come on. He was definitely running a fever all weekend. He was drinking from the bowl, but now he doesn't even want to drink from the bowl, and he's not eating, so I'm force feeding him water and food.
What's his energy been like at home?
He doesn't want to do anything. All he does is sleep.
And he did lose a little bit of weight as well.
Oh, I thought they said he increased.
No,
Oh, God.
No, he's down a little bit. You know, I think you're doing a good job with the nutrition. It's just he's just not absorbing it.
It seems like I'm feeding something. I'm feeding him, but it's not getting to him.
Okay. Tell me more about the situation where he came from. You know, he originally came from Arkansas, but then he went where from there?
He was abandoned on the side of the road with his mother, a brother, and a sister.
Okay.
And he was the smallest of the 3, but the 2 of them are healthy.
Okay. And how did he come here? He was delivered here by some delivery truck, or how did he come here?
Assuming.
All right. So let's turn over other stones as a possibility of what's going on here.
All right.
With Waffles, more things sort of came to light that didn't really fit just a rabies vaccine reaction. When you have a patient who's so complicated, has so much going on, and you don't have a diagnosis, then you start to dig a little bit more for the rare things. You're trying to solve a mystery. That mystery changes on a daily basis, sometimes on an hourly basis. It's almost like a Sherlock Holmes process. He is coming up positive for the fungal infection called blastomycosis. It's a rare disease in our area, so it's not on your radar. So I have a feeling what happened was he came from this very difficult situation, He was exposed to this fungus at some point, then he got a vaccine and it challenged his immune system too much, and then everything kind of took off from there.
So what do I do?
Essentially what we need to do is get him on an antifungal medication and then track his blood work. This can be a very long-term treatment.
Okay.
The medication is pretty hard on the body, so at some point I would want to do a C on him really to help him more with the medication than anything, because his immune system is working, it just needs help.
What do you rate his chances of survival?
It is a very vicious organism. It can go to the heart and the brain and the eyes. He can go blind. I'm hoping that we can catch up to it.
You did it.
He definitely has a fever.
Yeah, he's putting out heat like a furnace right now.
You're gonna beat this, Waffles.
Whether you're a person or an animal, it doesn't matter. Being in the hospital sucks. And if they are alone and they're feeling like shit and there's no reason for them, they don't feel like a dog or a cat anymore, they're just too down, what do they have? They don't do that in hospitals with people. There is a staff there all the time, in and out, waking you up, checking you, checking your line. So why would we do it with an animal that doesn't even have an idea of why they're here?
You're okay. You're okay.
They don't understand what's happening to them, so you have to remember that, especially when it gets crazy, because there are plenty of times we're crying on each other's shoulders. I guess if you want to compare it to human medicine, licensed technicians, we are the registered nurses, but then on top of that, we're also the phlebotomist, the x-ray technician, dental hygienist, the person who places the catheters, the surgical assistant, and we are the anesthesiologist.
Come on, Crystal. Wake up, sweetie. Come on, Crystal. Oh, hello.
2, 3. It's definitely not a glamorous job, and it's a very physically hard, taxing job. We had a 144-pound dog here yesterday, and had he been aggressive, it turns a whole new twist on things. But we still keep in mind, this is a scared animal coming in. They're just trusting us.
We're old friends, right, Joe?
Sometimes it's like being in a kid's daycare. It's a good one.
Hi, love. All right.
Mulligan is here for Dr. Goldstein.
How is?
He's 100%. He sleeps all through the night. He now does not pee every 3 hours. He can hold almost 6 hours.
Such a good sign.
And I'm always ready to look on the floor in front of the refrigerator, because that's his spot where he always pees. And it's dry. It's amazing to me.
What you're describing is great signs. So today, blood work. I'm going to give him his favorite injections. I'll make adjustments if needed.
Okay.
You brought the urine in.
I did. Fresh, the first catch of the day.
Yeah, which was really good. This is very exciting.
You know, everything I've learned from conversations and from seeing him, it's a whole new process of thinking. But what I don't understand is why this hasn't caught on in a very big way. It's so obvious, and you see, I mean, once you get it, it's so obvious.
Welcome to the struggle of my life. Let me examine Sir Mulligan. His disease, hopefully, is a thing of the past.
I had no idea what Dr. Marty would look like or be. And when I met him, he's like, you know, an adorable hippie, about 25 years too old for the clothes he's wearing. But they work somehow. What are you doing?
The flying nun. Flying nun. I know, I know, I know.
Hey. Oh. Oh my God. Oh my God.
What attracted you to Marty?
He made me laugh. And that was a huge quality because it's just, we just like to laugh about like stupid stuff all the time.
Well, when we go out to dinner or we go someplace with the kids, she introduces the four of us as her children. I'd like you to meet my children.
Yes. And my youngest.
Right.
We have 3 girls, teenagers, 4 dogs, 1 20-year-old cat. We have 2 lizards, and we have a parakeet. We have a bunny. We have 8 chickens. I'm not sure if we have more animals at home or at the clinic.
Come on, Red. Red, come on.
Working together. It's not always, peaches and cream. But we've always believed that if you're working towards the same goal, then it doesn't matter who goes what direction. Let's just get there.
Exactly. When we first started the date, she used to come over to my house. My animals liked her better than me. And I watched that even at the clinic. I watched how she had a way with animals, or they had an affinity for her.
That's when I first started at Smithridge back in 1996.
That was the old one, the Shack.
The old Smithridge Clinic.
Officially known as the Shack. Because integrative medicine was not an accepted modality. It was hard for me to work at its standard veterinary hospital, so I wound up having to go out on my own. And in 1982, my first practice was a kennel that I rented space in, because that's all I could afford. My exam room became my surgery room.
Our bathroom was the X-ray developer room. So if somebody was developing an X-ray film, you couldn't use the bathroom.
So when we started to get patients, people would walk into this place, they would look around and they would ask if they had the wrong address. Boy, we've come a long way.
Long way.
Wow.
Wow.
An email's probably better. Be quick, and pickup time is generally between 4:30 and 5, but depending on how quickly he wakes up. Smithridge, discussing how can I help you?
I'm Dr. Shane.
Hi, Dr.
Hi
Shane.
there.
I'm Jennifer.
Hi there.
Hi.
Nice to meet you. Hi, Petey. All right. So tell me about the consults that you've had.
Well, he's been to 5 vets.
Okay.
And then it all started when he got shots on a Wednesday, and he had a tumor on Friday. And then I brought him back to the vet on Saturday.
He never had it before.
And he was drooling crazy, and he had a runny nose after the shots, like a few days later.
So he had a reaction. So he was vaccinated without any discussion about it?
They're like, oh, he's due for this, this, and this. And I was kind of like, all right, get her done while I'm here. And then not realizing they,
they gave him the flu
they
shot,
gave him
the
a
kennel
flu,
cough vaccine,
a
leptospirosis,
and a kennel.
Would that trigger that to make it grow, or?
I can't imagine that happened in just 48 hours.
That's what all the other vets said, but it's hard for me not to believe it.
Right.
So then I went back. She said, I don't know what's wrong with his mouth. Then he went to New Jersey with her.
Right.
He goes on vacation, this dog.
Okay,
so
that's
then
awesome.
he went to a vet in New Jersey. And he called a week later and said that it was cancer.
Yeah.
Okay.
They said they would most likely have to remove his jaw and he would be deformed. I said, no, just, let me just think about it. And then I met a woman in the park and she said, oh, did you talk to Marty Goldstein? Because he'll do anything not to cut it out. And I don't know what her name was. So just a woman at the dog park told me about you.
Okay. All right, let's get a good look at you. You want to lay down, honey?
Go ahead,
lay down. Oh, you're the best. Oh, you're the best patient.
Of course, the sore's on this side.
Yeah, okay.
Here, it's over here.
All right, Mom.
They said the
Good
tumor's
boy.
inside by his tongue.
without sedation, it would be hard to really see the whole thing.
See, there it is,
Gosh,
right there.
he is so good.
There it is,
what
right
a
there.
dog. Oh my God. I have to assume that
It's okay.
that the tumor is completely infiltrating his jaw. So I'm definitely going to get Dr. Goldstein involved. I want him to take a look. I want him to give me his opinion on doing something for Petey's jaw.
I'm going to open up your jaw, team.
Hang on, buddy.
That's extensive.
It doesn't really seem painful.
Well, he's got it all the way back here.
I know. Yeah, there's some necrotic tissue in there. Ooh,
Smelly.
Okay, Petey, I know.
Well, we could at least do a major debulking of the cancer mass using cryosurgery. They want to do hemimandibulectomy?
That's what has been recommended repeatedly. She said, I've decided I don't want to do traditional surgery.
I'll come in with you.
Okay, all right. I have been working at a traditional practice for about 15 years. And Dr. Ruskin, who I had worked with at another practice, had been desperately trying to get me to come to Smith Ridge. But it didn't feel like the right fit for me. I thought it was going to be too holistic. Had a lot of preconceived notions about it. Marty, what would you like to use? Adrenal B12 and what? And then Marty started calling me. And they were tag teaming me to come in. And I said, okay. But I was nervous about meeting him. I didn't think I was going to like him because I had seen some of his medical records just from cases that we had shared and seen this list of supplements that I thought, oh, this is so ridiculous. I mean, it's just so long. And how could anybody ever take all of these supplements? And how could he possibly even know all about all of these supplements?
I don't think the homeopathic is going to do anything. The adrenal B12, I think.
But I met with him, and he was completely different from what I expected him to be. And I remember he said to me, so what do you want to do? Who do you want to be? Do you want to be someone who does this work? And my answer was yes.
Dr. Jenna, your 1 o'clock phone is on line 1.
Okay. This is a very difficult case. Cancer grows exponentially. If the replication rate of a cancer cell is every 4 hours, and you have a tumor that's composed of billions of cells, it could create billions of cells every 4 hours. And I've had people tell me that they have sat home over the weekend and watched their dog's tumor double. Radiation is an option. They're not going to go for it. Removing that whole jaw is an option. They're not going to go for it. So let's talk about cryosurgery. With cryosurgery, we actually freeze the tumor, and the freezing actually stimulates the immune system so that whatever cancer we freeze will get rejected. And then the body will lay down new scar tissue where the cancer used to be.
Wow.
But we save enough vital tissue for functionality of the jaw.
Coming from a traditional background, I can't even conceive of this kind of success.
Think about it. You get your finger frostbit. The part that really got frostbit will die. The part that almost got frostbit will fall along the defense, a wall of defense, and reject the other piece. That's what we want to do with cryosurgery. But at this stage, we are very time limited with this case.
Right.
If we don't do cryosurgery and they don't choose the other options,
There's nothing else to offer them.
Yeah. We don't like hemimandibulectomies, where you remove the whole jaw, unless it's the only thing that can save a dog's life. This one I would actually consider, but I know you don't want to go there. If he
I mean, I had made the decision not to take the tumor out. I didn't want to have the surgery, and I didn't want him to be deformed, and I want to go through the pain.
Yeah. The thing that makes this tough is the location and the size and the firmness of it. All of this cancer, I know I can freeze. in the body we rejected.
It's what's growing inside the jaw.
It's this one here and getting exposure. I'm sure at least one or two of the teeth, at least, are going to have to come out to give me exposure. We don't care about that as long as he has a jaw.
Yeah. It's like a gamble. It's like a 50-50 shot, pretty much.
It's probably less than that.
But would nutritional supplements let it grow slower, maybe? Or stop it from growing?
Yeah, I don't think so.
Yeah.
This is a tough one. And if we elect to do cryo, it's going to be a long haul.
Okay. I got to sleep on it, I guess.
Yeah, a lot to think about.
We will.
We will. It was a pleasure.
Yes. Bye, Boo. Okay. He's been to 5 veterinarians, and no one ever mentioned that before. It took a stranger in the park, the dog park. Because I could have been here 2 months ago.
Because it was so extensive at that point, the family decided to give Petey the best life that they could for whatever time he had left without any surgical intervention. He didn't suffer, and when it was time, they put him to sleep. You just never know how you're going to handle a situation until you are the one who's actually in it. And I certainly don't think that it would be fair or right to judge that they should have done anything differently.
Ruby's ready to go back?
What, baby? What? Tell Mama. What's ailing you? You'll be okay. Yes, you'll be okay. I know.
Scooby is another patient that came in with a poor prognosis. The case is very, very similar to Petey. And the owners came here looking for cryosurgery. They got here just in time.
Okay. Scooby's tumor is getting worse. He's not eating much. In 5 days, he probably ate 2 times. His original veterinarian told me that he had about 4 months to live.
This is our tank of liquid nitrogen. Liquid nitrogen can get down to minus 99 degrees centigrade. Kind of feel like Boris Karloff. Yeah. Stay clear. Cryosurgery is not a sterile surgery. We don't have to go into the sterile room, and I could just wear a scrub suit. Wow. There's a lot more involved here than I originally thought. And approaching it was going to be difficult. Once it starts to freeze, it freezes quickly because it's so cold. You can see all the freezing going on. You see it, the freeze traveling down?
Yeah, wow.
It's amazing, huh?
When I first heard about cryosurgery, I thought that it sounded barbaric and crazy. And how could you freeze these tumors and wait, the dog eats the same night? Hasn't eaten in 2 weeks, and all of a sudden you freeze the tumor and they eat that night and doesn't need a tremendous amount of pain medication, and like, it's crazy.
It's getting all the way down to there.
Wow.
In general, as great as cryosurgery is, surgery does not cure cancer. It removes a symptom of immune deficiency. This is going to hopefully save the jaw, buy us time, so the nutritional supplements will work.
In all likelihood, Marty, he's going to need more than one procedure.
Oh, yeah. Yeah, we're out.
Scooby, how's he doing?
Oh, he's wide awake in the cage. Now we got to see. Because the only thing we don't have with cancer is prediction. We have to monitor them like a hawk. If he's going to grow back cancer in 2 weeks, there's not much we're going to do. Not with the way I froze to do. And if this is a fibrous tumor, it could come back with a vengeance. We just don't know. Oh, I didn't never see you guys. Makes it look like water.
Tell Mom, you're gonna be okay. So we're here today for Scooby's recheck with Dr. Marty. He has gained 3 pounds. He's energetic. He's a lot stronger than he was before the operation. He's running. He's back to his old self. Just eating is a bit of a problem, but Dr. Marty suggested to get a Boston Market chicken, and that did the trick, and he eats one every day, 1.5 sometimes. The surgery site is right here, and they removed his tooth. And Dr. Marty doesn't want us to clean the wound site. He wants the bacteria in there so the body fights harder to fight off the cancer. So everything you would think to do, you're not supposed to do. I just gave him 2 homeopathic shots, so he said that should give him even more energy. As long as he's okay and he bounces back, it's all worth it.
Yes. I got invited by the Integrative Veterinary Medicine Club to give a presentation at, of all places, my alma mater, Cornell. So this time, I'll talk to the next generation. And I'm hoping those new vets coming out will start to spread this word.
The days of paper.
And I haven't seen these folders in umpteen years.
You want to do the cryo, you want to do the cancer, you want to do the nutrition.
Abigail, I want to do because that was verified.
You should definitely talk about this one.
You ran this case? This was the mast cell tumor. They wanted to amputate the leg. We did cryosurgery. And then she lived to like, I think 16 or 17. Wow. That's a great cancer case. Lyme disease, renal failure.
Do we have anything with the nutrition?
Brutus.
Oh.
He was diagnosed with Cushing's when he was 18 months old. One of the youngest I've ever seen. And we got him to almost 17.
Yeah. Who is that? Oh, Fia.
Oh!
Fia.
She was the cat that looked like Jay Leno. 4.5 years old. Every joint in her body was fused. This was literally living rigor mortis. And 1 injection of a homeopathic remedy, and 2 hours later, she was normal. And then she lived to like 14 and a half.
Yeah. Why don't you make a pile for that's a given so that you can later on make notes.
That's a good idea.
Waffles is back.
Waffles!
It doesn't start getting any results, so that's why I was calling.
He's unsteady on his feet, and he's not drinking or eating. When she gets him up in the morning, she kind of has to like let him balance out before they can start walking.
Okay, all right. So we have a bit of drama with Waffles. He's pretty weak, he looks pale, he's jaundiced. It's either some sort of autoimmune thing that's happening, possible vaccine reaction that's ongoing, or his blastomycosis, which has been, knocking him off his feet for months now. All right, he can go back into Mama. Is that his blood spinning cath or his is running in the machine? Okay. He's a moving target.
Dr. Jenna, line 1.
It's bizarre. He is severely anemic right now. Wendy, can you let her know that I have an emergency here, so it's going to be a wait? His red blood cells are reading at 20%.
Okay, but that's a good thing.
They should be at least 30%.
Okay.
And I think that we're going to have to bite the bullet and do a blood transfusion. Then we can decide what to do from there, depending on his response. But blood is not something we have in the hospital. We have to go and get it from another hospital. So I'm gonna try to call around and see who could give us blood, because we don't have, a lot of time here.
You think he's strong enough to withstand it?
Yeah. I've seen a couple of dogs that I look in their eyes and they're quitting. But most of them fight and they're willing to keep trying. And he's trying. So I won't give up until Waffles tells me to give up.
All right. Okay.
Dr. Buskin here has determined that he needs a transfusion, and she asked me to call to see if you have a unit of cat blood cells.
One of our doctors has determined that our patient needs a blood transfusion, and she's having us call around to see if we can get that for him.
We don't have any blood here. That's why we're calling you guys, Sam. Yes.
Apparently, all the blood banks are on back order and stuff.
Yeah, all right. I don't really have enough time.
Want to send someone?
I have to, but I think that's our only choice at this point. This is crazy. All right, who had blood? Newtown had blood?
Newtown has 1 unit.
So why don't we go there?
Okay, so I should just go.
Just go over there.
Okay, all right. Well, hopefully this is going to do it today. After the blood transfusion, I went back to the emergency room the next morning, bringing him his food, which I made up. I delivered it there at 6 o'clock, and they came in, they brought him in, and he was yellow. He was absolutely yellow, and I was horrified. And that's when they had the discussion with me, well, you got yourself a lemon here. And following that was the discussion that he would be lame for the rest of his life, and Dave and I should give some thought to putting him down.
Come on, you want to sit in the sun?
So I called Smithridge, and Dr. Ruskin said, we need to give him a few days. Let me take a look at him, and if he keeps on fighting, I'll keep fighting with him. Yeah, boy, you were hungry. You ready to go to work? Huh?
Look at his ears, you know? Look how alert he is.
Yeah.
Yes. Yes. Who loves you? Who loves you? Oh, yes.
Come on. He is back to the way he was.
Waffles. That's amazing.
Isn't that nice? He's playing, he's eating on his own.
Little kisses,
A little fighter, you. Hey.
Oh my God. So great to see that tail wagging get a kiss. Oh my God, those kisses are worth $1 million to me.
Waffles.
You proved it. You did so good.
You need to mooch him now. Good boy. All right, so he's gonna check his blood, see if that's also following everything else great that we're seeing here. Let's be back. Look who's here.
So much bigger. I
No
know. Look at this.
ribs.
Look at this.
Feels
No
so
ribs.
good in arms.
Just PCV, CBC.
PCV, CBC, yeah. Good news. 36. 36. Oh, he's in the normal range.
Is it?
Yes.
All right, Muffles, way to go.
Oh my God, here come the tears again. Oh, yeah, this boy. Okay, 36. Everything's going. Just blossoming into a puppy again. Yeah.
You're only going home with one new thing.
What is it, the BH?
Yep, that's your one new thing.
Your one new thing. Here, we'll give you a little bit. Because it's a homeopathic.
It absorbs into the
yeah,
gums.
20 minutes before and after food.
Got it.
Alrighty.
Oh, cute.
Well, I know it's a little big for him, but...
Scooby's ready to go back?
Hi, buddy.
He acts like there's nothing wrong with him. Doing 2 walks a day, 2 long walks. He wants to go to Home Depot, he wants to go to the supermarket. He just wants to go out the door.
He wants to live.
Yeah. Look how big it got.
He's such a good boy.
He's a good boy.
It's that, and it's something in the back as well.
Okay.
Well, we have recurrence here, a little over there,
Yeah,
but for a bone tumor 6 months later,
that's incredible.
it's beyond. And with lymph nodes, which were huge when we first started, I could barely palpate them now.
No, I didn't feel it either. I thought the same thing.
Yeah,
It's like,
amazing.
wait a minute, where is it? How's that possible?
It's remarkable. Not cured, but phenomenal. I'm going to cryo. What I always say is that stability in the face of expected decline is actually improvement. Metastatic bone cancer, if you look in the references, weeks to live. We're going over half a year. He had one major cryo the first time. He had a very tiny touch-up, I think 6 weeks later, and now this is the third. People say, well, that's a lot of surgeries. But when you realize typical radiation therapy for cancer could be 16 to 25 radiations every day for 4 or 5 weeks under general anesthesia for 30 or 40 minutes. So 4 anesthetic procedures over 6 or 7 months is not that bad. It's less invasive. It's usually less bleeding. It usually requires less anesthetic. We do a lot of tumors under a local where normally they'd have to be put under anesthesia for 45 minutes to cut it out. It's the only form of surgery that's known to be immune stimulating, tissue sparing. Why this is not standard operating procedure in all the hospitals in the United States is beyond me. The other good thing about it is his quality of life is so amazing. And that's what it's about. But I want to save these biopsies because somewhere along the line, some totally conventionally based veterinarian will say it was probably misdiagnosed and never was a cancer.
Kiss. Yeah? Okay.
Can I get kissed too?
Give mommy a kiss.
Want to get kiss? Only daddy gets kisses?
Nah, you kidding me?
All right. How are we going?
People are always like, how much is this going to cost you? Or just euthanize him, euthanize. So you take him, you look at him in the eyes, and you want to euthanize him? Oh, no, he looks good. Even his fur looks really good.
It starts looking good right away.
He's been through a lot of surgeries, but he bounces back. 2 days later, he's jumping in the lake. He's not suffering at all.
That's why we're doing what we're doing, because he's really showing that he's got that strength in him, that he's fighting.
When his original vet said 4 months he's gonna die, I just thought that there was nothing we could do. And that was a year ago already.
He's gonna start tossing sand towards me.
Now, what I'm going to do is I'm going to buzz through the whole thing.
Do you want me to stop you if I see something that I think should be
No,
out?
make
Or
notes.
do you want me to make notes and
Yeah.
just go over it at
Make
the end?
notes and then we'll go over it later. So,
All right.
because I want to kind of time it too.
Then stopwatch.
So you ready?
Yeah.
All right, let's get into some real good stuff now. This is a book about how the pyramids were built. At the same time that this was done, acupuncture was laid down. Pet food, whole grain corn, whole grain wheat. Do dogs in nature eat at bakeries? There's the tumor. We infuse it with lidocaine or marcaine, and we freeze it. So cryosurgery is real medicine.
Stop! You have to kind of switch gears a little bit. You know, a lot of times you talked like you were talking to like a general public, not a veterinary student. They want to know how you made this dog better. How did you make this cat better? And what did you specifically use?
I can't teach you integrative medicine in 35 minutes.
But that's why I think you should take 3 to 4 cases and basically do a rundown. Like with Fia, you did a great job because you actually said, I gave her an injection of homeopathic remedy called Zeal, and it worked.
The next 3 animals may not respond to Zeal.
But see, that's what you need to say. What did you put them on? Individual supplementation program according to their blood work. They are all individual, different animals.
You know, they might not like that because when they learn medicine, they're being taught everything works. This drug will create this thing.
But you're proving that doesn't because they're all coming in after being on drugs. These dogs, yes, went through all the antibiotic courses that they were recommended. They went on steroids, they were on surgery lists, they were on this. But now you have to show them that why my therapy worked is because I used this.
baby. Here we go. Here we go.
Mulligan is here for Dr. Goldstein.
This is Molly's results. Creatinine, last time it was 4.5. 2.7.
Wait, is that good?
That's great.
It's gone down.
Yeah. But the good one is hematocrit, 42, is normal, and hemoglobin in the normal range. It's the enigma, AKA Mulligan.
You know, I've gone back to our local vet and told them about this. And the particular surgeon has been stunned. I mean, she just keeps looking at him and saying, I can't get over, how could this happen? He is fabulous.
We are responsibly addressing his condition as well as we can with no side effects. She can be doing this too.
I'm not just grateful, I'm just like, I feel like if ever he should fail, I had all this gift. It's really a gift.
Yeah. Now we're going into years.
Yeah.
Hey, Mo.
Hey, Molly, we're talking about you. He
Look,
thinks
I have
you're
my
crazy.
almost
He
Mulligan.
thinks you're crazy, so
Right, yeah.
he never reacts to you appropriately.
Right, Mulligan.
Or maybe that is appropriate. From the very first session, Dr. Marty didn't say we can cure this dog. He said he couldn't cure the dog, but he said he can extend his wellness, and by so doing, the dog himself will be able to work on his own problems and hopefully get more life. I'm not against anything holistic, I just never had tried anything like that. But his changes have been so visible. Seeing the difference, I started exploring this kind of concept holistically for human beings, where they test blood and change everything according to what you need. I have the worst diet in the world. I eat chocolate and Diet Pepsi and bacon and all of the above. So I've scaled back on the kinds of not so good for you foods. And then I started supplements, and now I'm never tired. I've lost a certain anxiety. I'm much calmer. But I still eat bacon. I can't help it.
Does he seem better today?
I think he seems about the same
As yesterday?
as yesterday.
Yeah. How's his kidney values? Did they run more blood?
We haven't rechecked the values. We're scheduled to do that this afternoon.
Okay.
I was trying to keep him comfortable.
It's just so surprising how it came on so fast. Dr. Ruskin!
Aw.
I'm so upset.
Honey. Oh.
I don't want to lose her.
I know it. All of this, right now I think all of this is secondary to a kidney infection. But for now, we're just kind of supporting him, flushing him, keeping him hydrated. Having a kidney infection is really exhausting, painful, really throws your body into a tailspin.
Do you think we're at the point where, well, you don't know what his quality of life will be?
I don't know. Yeah, I mean, if I can get the infection under control, he could pull through this and be fine. If he continues to decline despite what we're doing, then then it's not good.
Okay. right here, lovey. Take your time. Okay. Take your time.
Oftentimes with patients, they have a way of speaking to you and telling you that they're done fighting. The body kind of makes the decision for you, and you just know when you look at the pet. The disease, the blastomycosis that he has, finally gained access to his kidneys and caused kidney failure. So we all sort of came to the conclusion at the same time that it was time to stop trying. I really do fall in love with every patient that I have, and letting them go is extremely difficult.
Look at you standing there like such a big girl. You're so adorable. There is definitely an emotional connection. It's hard to actually think about how attached I get. That's probably what makes me a good vet and also what tortures me. And I sometimes wish I would lose that quality because it would be easier, but I really don't want to.
Terrify you, kid. Who's the best girl? It's okay, love.
You're the one holding that life and death in your hands. And I know there are other older vets that I know who actually won't euthanize anymore. They pass it off to their other associates because it's too hard for them to do. And I can understand that as well. Year after year after year, there is a toll. And it's not just an injection. There's a life and a being and a consciousness. And we're the ones left with the aftermath and the pain associated with that. So that's probably the hardest part of my job.
The day Waffles passed, Dr. Marty came in and spoke with us about the death of a pet. While he was talking to us, I started to think about all the other veterinarians who said to me, "Where you're going is a load of crap." It's not an easy leap to make. I think it's an easier leap if it involves a person. But I think a lot of people have a second thought because they're like, well, it's just an animal. But my opinion was that he was just a puppy and he deserved to live his life.
Many animals that I've worked on, we've taken past the point of conventional medicine. Even if they don't make it, what I always say is in your heart, when you made that choice to try this, you made it to do the best thing you could. We try to get our patients a better quality of life. Quantity usually accompanies quality. A dog will come here with 5 weeks to live. And we struggle, and we work, and we do cryo, and we're on supplements, and we're taking blood. 2 years later, the tumor is still there and this and that, and the people say, "Do you think it's working?" Yeah, he had 5 weeks to live 2 years ago. I used to sit here 48 years ago. That was me, 1973. Now, there's 190 million registered cats and dogs in the United States. So we see many, many animals. They come in young, we do a minimal vaccine program, we put them on good diet. When they're a year old, we take blood, we put them on supplements, and they'll live to 14, 16, 18, and sometimes beyond that. You want to be skeptical? You can. But this is the future of where our profession is going. All right, let's cut to the chase. Cryosurgery. This dog was referred to me, and I asked the one oncologist what his prognosis was, and he said, probably 5 months. That's me freezing the tumor. 2 weeks later, 5 weeks later, 4.5 months. That's 7.5 months. Last thing we heard was the dog was still alive 8 years later. The referring veterinarian referred to me as a kook when he found out about cryosurgery. This is what I'm trying to break through. This is the package insert on every vaccine, intended for use in healthy animals only. I am not anti-vaccine. We standardly vaccinate all the time. But this is a case I took on 2 months ago, 9.5-year-old dog from Virginia, tested positive for 3 diseases this veterinarian diagnosed, and then gave the dog a DHPP, lepto, and Lyme vaccine. Why do you take a dog with 3 diseases and challenge their immune system at the same time with 6 more diseases? This, unfortunately, is standard operating procedure, and in my opinion, malpractice, because it's violating what the drug companies say. Vaccinate healthy animals only. All right, let's look at a miracle case. Let's look at what's causing immune suppression. Let's look at glandular therapy, injectable homeopathic remedies, supplements, intravenous vitamin C, the validity of acupuncture and veterinary medicine. Who's got a question?
So obviously there's not a whole lot of this in our official curriculum here at the vet school, so how would you recommend us as future veterinarians go about learning all this information and these different treatment options?
The one good thing right now is you have society in your favor. You have crazy people like me that are out there that are showing this. And the bandwagon is moving in this direction. Society is finally starting to listen. Question?
Do you think it's more we need scientific information, more scientific studies, or do you think that the years of data that we already have is good enough to make that change and now it's just a policy kind of issue?
What a great question. My number one criticism over my career, if your cases are so great, why haven't you published? Why haven't you documented? I'm a clinician. Animals are coming to me from all over the United States with really distraught families. I'm not going to take 9 cases of lymphoma, put 3 on alternatives, put 3 on chemo, and put 3 on a placebo. That's not me. So my hope in my lifetime is for me and other integrative veterinarians to work in conjunction with a facility like Cornell to get science-based evidence that integrative medicine works. You're not going against what you're studying. You're incorporating more. So I so appreciate you guys coming today. Thank you. Start the bandwagon rolling.
I'm a first year, so I just started 3 weeks ago. I don't know very much yet, but no, I'm really glad that I found this during my first year, because now I have the whole rest of my first year and all the other years still that I can explore it and learn more about it.
I honestly never thought that I would see the acceptance of my work within my lifetime. And so it's becoming exciting for me now because we have an audience that'll listen. I set myself up for a hell of a lot of hardship. It's not been easy. But if I gave up, knowing that this can be done and this could be accepted, that would kill me.
Oh, good boy.
Because picture the dog and picture the cat in your house, wagging its tail and licking your face, and how good that makes you feel. It's incredible. And we need that. because we don't wag our tails enough. No, they do this 7 days a week, 24 hours a day, except when they're sleeping. So if I can make the companion animals better, and they can bring us more joy, what? How much more of a win can you have in life?
I love my dog as much as I love you. But you may think my dog will always come through. All he asks from me is the food to give him strength. All he ever needs is love, and that he knows he'll get. So I love my dog as much as I love you. But you make the fade, my dog will always come through. All the pay I need comes shining through his eyes. I don't need no cold water to make me realize that I love my dog as much as I love you. But you make the fade, my dog will always come through. Na 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 na. As much as I love you, but you make the fade, my dog will always come through.